At ASCO 2018, we presented data from a prospective trial of axitinib in patients who had failed checkpoint inhibitors. As many of you know, immunotherapy, specifically checkpoint inhibitors, are taking over the frontline landscape of kidney cancer with Ipi/Nivo's recent approval, data on atezolizumab and bevacizumab, and other combinations coming. And so the default therapy after failure of one of these frontline IO-containing regimens would be a TKI, although no prospective data existed. So we did a trial of 40 patients that was done across about 5 academic centers, looking at axitinib on a personalized titration schedule. And these were in patients who had failed PD-1 inhibitors as their most recent therapy. So this is a typical refractory metastatic kidney cancer population, and they received axitinib at a starting dose of 5 milligrams twice a day. And what was unique about the trial was the way that we titrated axitinib. So as many of you know, the normal titration is from 5 to 7 to 10 milligrams twice daily. But those are fairly big steps, and often patients don't tolerate those big steps. So what we did is titrated them about every 2 to 4 weeks in smaller increments. So 5 twice a day to 6 twice a day, 6 twice a day to 7 twice a day, and so on. It allowed us to get up to higher doses than with the standard titration scheme. Most patients got into the 6 or 7 milligram range and stayed there. Another important feature was that we allow patients to take breaks from medicine. So in clinical practice, I find taking breaks from drug every few weeks, taking 3 or 4 days off, really helps to recharge the batteries. So anyway, in this trial of 40 patients, we saw a response rate of nearly 40%, a RECIST-confirmed response rate, and a progression-free survival of 9.2 months. And this is as good or better than all the retrospective data sets out there, and I think sets the standard for the activity of TKIs in this setting. No doubt that many TKIs are active in this setting. This is the first prospective data, and I think will provide a baseline for future trials to come.